One of the problems that we try to address here at Deakin Rural Health is access to healthcare, especially in rural, regional and remote Australia. This project came about because of the lack of services and lack of access to sexual and reproductive health services. So the first part of the project was understanding where the physical locations of sexual and reproductive health services were across the Barwon Southwest region. The second part of the project was really focused on understanding the barriers and facilitators of access. And what we mean by that is understanding all of the different elements of access beyond physical access to a service. So this might be looking at the affordability, whether the service is culturally safe, whether we're able to access the service in a timely manner.
This collaboration with Deakin was really important because the wonderful people at Deakin have the research ability, and in this instance had the technology, the amazing technology, to undertake the mapping exercise to really give us visibility of the barriers for women and girls to access sexual and reproductive health services. There are really specific barriers for women in rural and regional areas. The combination of distance, lack of services or number of services in the regions, and also some of the very specific conditions that occur in small towns mean that it can be more challenging for women in these areas to actually access services. So having a really clear picture of this gives us an opportunity to be able to actually address those issues. There hasn't been the data, and contributing to the evidence base around this is something that we're very proud of.
We gathered all of the data about the physical location of where these sexual and reproductive health services were, and we were able to use technology to map the physical location to each address point across the region. And what we did was calculate the time someone would have to travel to the service. So this is one part of access. One of the big findings was the lack of publicly available data around where these services are located. So we know where GP clinics are located, but we don't necessarily know what services are being offered. And there's a lot of stigma around being publicly listed provider of some of these services. So for a woman needing to access these services, it's really important that they're publicly available and publicly listed so that they're able to access this information from the privacy of their own home and know where they can go for the care that they need.
The main value of this project, I think, is going to be its use as an advocacy tool. It will give people like my team at Women's Health and Wellbeing the opportunity to actually go to decision makers and policy makers and provide evidence around some of the challenges for women and girls in our area, in our region, and then try and take positive action to resolve some of those issues. We at Women's Health and Wellbeing Barwon Southwest were able to contribute our data and our connection to women and girls in the community to actually inform Deakin around the research, the problem and the research that needed to be undertaken. So we had a position within the project of actually providing that level of expertise and that connection to the community issues.
Working with organisations that are deeply embedded in community is incredibly valuable. Women's Health and Wellbeing Barwon Southwest have the specialist knowledge of sexual and reproductive health within the region, and it provides that value in terms of understanding the context, understanding the story behind the data and the evidence that us as researchers were able to find. Having the data on sexual and reproductive health service locations is the critical first step in ensuring that resources are equitably distributed to women living in rural and regional areas to ensure that they have access to the healthcare that they need and they deserve.
Ultimately, we would love women and girls across our whole region to have access to all of the sexual and reproductive health services that they need without the significant barriers to being able to access them. So we're very hopeful that by contributing to the body of evidence around this, we can really convince those that are able to make decisions or influence policy around making a real difference and ensuring that women and girls can actually have great access to the services they need.